Hello, this is Dr. Michelle Cotty, and today we are going to listen to a lecture by Professor Margaret Steiner. She is a retired member of the Mount Carmel family, and her lectures were done so well that we still use them today. The objectives are describe how cancer cells develop, differentiate the characteristics of malignant and benign cancer cells, define basic cancer terminology, explain how metastasis occurs, discuss various risk factors that can lead to cancer formation, identify the types of treatment for cancer, and distinguish the role of grading and staging of malignancies. You may want to pause the lecture here and pull up the corresponding study guide that goes with this lecture. That study guide is where we get our test questions from. So you can write on it as we go through the lecture today. All right, let's get started.
Let's begin our discussion of malignant neoplasia by defining neoplasia. Neoplasia is not a malignant word. Neo means new, plaso is a volume of tissue, and IA means condition of. So neoplasia means that you have a new volume of tissue, and that new volume of tissue could be benign or malignant. The focus of this presentation will be on malignancy. And look at that word element mal. Mal means bad or evil, tending to be severe and become progressively worse. And isn't that what we think about when we think about cancer? Something that's bad or evil, something that's severe and becomes progressively worse unless treatment is provided. You can review cancer incidence and mortality statistics in your textbook. This is an FYI for your information only. In terms of estimated new cases, in women it's breast cancer and in men it's prostate. Estimated deaths, the number one cause of cancer-related death in both men and women, is adenocarcinoma, cancer of the lung and bronchus. Recognize that neoplasia can be either a benign or a malignant cellular change. Neoplastic cells in general need no signals to start dividing. Neoplastic cells ignore signals to stop dividing. Neoplastic cells do not die off, do not undergo apoptosis. And again, neoplasia means a cell can be either benign or malignant. That new volume of tissue is either benign or malignant. Let's discuss why cancer is a genetic disease. Genetic meaning mutated genes. Mutated genes result in uncontrolled cell division, and the cells that are generated when these genes mutate do not look like normal cells, and they do not behave like normal cells. There is a gene called the Ras gene, the RAS gene. It's a protein that regulates cell division, maturation or growth, and specialized function. It's found on the short arm of chromosome 12. This gene is mutated in 25 to 39% of cancers. So there's a problem with cancer, with cell division, growth, maturation, specialized function. Cancer is thought of as a genetic disorder because the genes mutate. Malignancy is the result of DNA mutation, uncontrolled cell division. Cells neither look like nor perform or function like normal cells. Defines carcinoma. In oncology, the word element carcino means the cancer is of epithelial tissue, of epithelial origin. And most malignancies are carcinomas because epithelial tissue is very mitotically active. It turns over a lot. And every time the cell divides, there's the risk for DNA mutation. Most malignancies are carcinomas. They arise from epithelial tissue. What does it mean to be an adenocarcinoma? Carcino is epithelial and oma means tumor. Adeno is glandular. So an adenocarcinoma is a malignant epithelial tumor of the mucous glands. Adenocarcinoma. And again, many malignancies are adenocarcinomas. When you read the pathology report, you will see that it is a malignancy. It is an adenocarcinoma. As an example, a benign tumor of the breast could be an adenoma, a glandular tumor, or a fibroma, a fibrous tumor. Malignancy would be an adenocarcinoma. When you see carcino, that's a malignant word element. Adenocarcinoma, a glandular epithelial malignancy of the breast. You will find adenocarcinoma of the colon. You will find adenocarcinoma in the colon, glandular epithelial malignancy. And that malignancy might be in the head of a polyp. Adenocarcinoma of the polyp. This is a polyp that you see here, a polyp. It could be in the head of the polyp, but it would be an adenocarcinoma, a glandular epithelial. Some malignancies are sarcomas. Sarc, that's a malignant word. It means connective tissue, a tumor of connective tissue. But sarcoma is malignant. An example would be osteosarcoma. Bone is connective tissue. Sarc is connective tissue. Osteosarcoma would be cancer of the bone, cancer of the connective tissue, specifically the bone. Osteosarcoma. A lot of people are frightened when they hear the word dysplasia. Dysplasia is not malignant. DYS means abnormal. Plaso is a volume of tissue. And IA is condition of. So dysplasia is a condition of abnormal volume of tissue. And you can see here that the cells on the right look different than the cells on the left. The pathologist would say that is dysplasia, but dysplasia is not malignant. Dysplasia is not cancer. Dysplasia could potentially become malignant if it mutates again and again and again. If the DNA keeps mutating, it could mutate into severe dysplasia or high-grade dysplasia, which is considered a malignancy. Mild and moderate dysplasia is not malignant. Severe dysplasia, now that could be considered a malignancy. Severe or high-grade dysplasia. Note that mild dysplasia is a few cells, oftentimes we'll say a third. Moderate dysplasia, more abnormal cells, and sometimes we'll say 2/3. Severe dysplasia, all the cells sitting above the basement membrane are abnormal. Severe or high-grade dysplasia. That severe dysplasia we would call carcinoma in situ or carcinoma in situ. Carcinoma means epithelial. In situ or in situ means in place, localized, or pre-invasive. All of the malignant cells lie above the basement membrane. Note the basement membrane that separates layers of tissue. All the malignant cells lie above the basement membrane. Severe or high-grade dysplasia may be considered carcinoma in situ. And why do we consider severe or high-grade dysplasia carcinoma in situ? Severe or high-grade dysplasia and carcinoma, which is malignant, carcinoma in situ, are often indistinguishable under the microscope. Following severe dysplasia or carcinoma in situ, what happens next? Well, cancer grows by invasion. It pushes through the basement membrane using enzymes. Cancer grows by invasion. So following severe dysplasia, carcinoma in situ, the cancer moves below the basement membrane through the process of invasion. Malignant conditions grow by invasion. Benign conditions invade or compress surrounding tissue, while cancer invades. Notice on this picture that the cancer is just below the basement membrane. It has invaded using enzymes to cut through the basement membrane. Cancer grows by invasion. The ability to invade is a characteristic of malignant cells. Let's do a little review here. Dysplasia, mild and moderate, is not a malignant word. Notice that most cases of mild dysplasia will go back to normal. A few cases will progress to moderate, meaning about 2/3 of the cells become affected. But even then, some of that will go back to normal. Severe dysplasia, notice the dotted line, we don't expect that to go back to normal. Severe or high-grade dysplasia is another way of saying carcinoma in situ. And once you have carcinoma in situ and the cells have become malignant, carcinoma, that's a malignant epithelial tumor, there's no going back. You're at the point of no return. Carcinoma in situ is above the basement membrane, and local invasion occurs when the cells move just below the basement membrane. Now let's do a review. Let's say some trigger affects the cellular DNA. Put these steps in order. When the DNA in the cell mutates, it may start out as mild dysplasia. About 1/3 of the cells are abnormal. That can progress to moderate dysplasia. About 2/3 of the cells are abnormal. Carcinoma in situ, severe or high-grade dysplasia, all of the cells sitting above the basement membrane are abnormal. Carcinoma means it's been biopsied and the cells are malignant. Carcinoma, a malignancy affecting epithelial cells. Another way of asking the same question is to put it in multiple choice format. Which of the following steps came first? Put the steps in order and pick the one that came first. When you put the steps in order, DNA mutation is first. What causes cancer? DNA mutation. Something can trigger that mutation, but DNA mutation is what causes cancer. This image represents cancer cells sitting above the basement membrane. The phrase that describes this is carcinoma in situ, when all of the malignant cells lie above the basement membrane. Now let's fill in the blanks. The DNA has mutated. Cell division is uncontrolled. That's why you have a mass of cells that form a tumor. Cell division is uncontrolled. All malignant cells are lying above the basement membrane, and we call that carcinoma in situ.
Okay, we're going to take a stretch break there, and then we will be back for the next portion of this lecture.